before we talk about vaccines, which is what everyone wants to talk about these days, I do want to actually acknowledge a couple of other points. The first one being that we have seen improvements in our transmission rates, community transmission rates, as evidenced by improvements in our test positivity and our case per 100,000 rate. Let it be known, though, that we still have a ways to go in terms of achieving the levels where we were during the summer, where we did make provisions to reopen certain segments of our businesses and our society, if you will. We continue to monitor those trends, and we also continue to reach out to our colleagues across the region to discuss, much like we have talked about moving together, whether it's around closure or reopening. We continue to work to understand how we can work together to be able to achieve those goals. Now, what is different and continues to be different from the summer is the fact that we are extremely concerned about the presence of variant strains within our region. We're concerned about the variant strains because they are highly more contagious than the novel strain. And we don't want to have a situation where we create a petri dish, if you will, that allows for those variant strains to come into the community and flourish and spread quickly and see our numbers rebound back to higher levels. So we do recognize that we will continue to get lots of requests to reopen certain things and certain aspects of society. Please be patient and continue to be mindful that we are continuing to monitor the surveillance trends that are present within our community, and our guidance will be based upon those factors, consistent with the approach that we took last year when it came to these certain topics. One of the goals of reopening in the next couple of weeks is to have our children return to school in some capacity. And part of that is, again, working to ensure that educators do have access to the vaccine. We anticipate this may be a question later today. We have been working to devise some strategies with community partners to be able to increase points of access for our educators and staff to be able to receive at least one dose of the vaccine before returning to the classroom. I don't have final formalized details to share with you in this public forum today. We'll continue to work behind the scenes to help facilitate that. We have been in touch with our colleagues from MCPS to find out how many of those individuals are left before the first phase goes back on March 1st, and how many other individuals would need to have the opportunity to get a vaccine before March 15th when the next wave of folks go back. So we're working on it, and we are close to hopefully being able to have some finalized details to provide those opportunities for extra protection as they go back into the classroom. The third thing I'd like to mention is a special thank you to all of the staff who were involved in the vaccine clinic process. Last Thursday, we did have to cancel our clinics due to the weather, and we were able to move those and stand those up on Saturday and Sunday, respectively. And from my understanding, there were minimal instances with problems of moving those appointments, and we were still able to capture the overwhelming majority of individuals who were scheduled. We'd also like to highlight the tremendous work of all arms of the county team that participated in standing up a clinic at the East County Rec Center on Sunday. This was our first weekend opportunity. We were attempting to try and pilot some different approaches around registration and getting folks in. And in a 4-hour session, we were able to provide vaccines to over 500 county residents. We hope to be able to pattern future events after this model, as well as we continue to explore other strategies, including increased community venues, again, pending more doses, potentially in terms of an allotment, as well as hopefully standing up by the end of the week, if possible, a mobile pilot that would focus on homebound individuals, as well as explore the use of a mobile type unit to provide community vaccination points across the county. We continue our outreach and continue to work with our different partners to bring folks up to speed and hopefully encourage them when it is their time in the queue to get the vaccine. So with that in mind, I will, if I'm able to share the screen, we'll just go through and share some of the numbers from the Pulse report so that you get an idea of where we stand. Okay, All right. So again, here's just a graphical representation of where our numbers stand right now. You can see how we have our first wave and we're currently trending downward. We still technically are in the high transmission range. You can see during this time period here, we were at lower levels when we reopened from stage 0 to 1 and from 0 to stage 2. Here's a breakdown of the different groups and how many folks have been vaccinated. As of yesterday, we had achieved just shy of 60% of our 75 and plus residents who had received the vaccine, at least the first dose. And let me also be very clear to the folks at home, we are not waiting for that number to be 100% before we move forward. We are hopeful that we'll be able to offer at least an invitation to all of the residents over 75, hopefully very soon. And once we've been able to do that, then we would contemplate moving to the next phase in terms of prioritization groups. Let me remind people at home that out of any of the other venues within the county, separate from the county operation, any individuals in 1A, 1B, and 1C can get vaccinated. The county continues to prioritize 75 and up. And again, hopefully in the near future, we'll be able to at least offer an invitation to the vaccine to all those who are 75 and up in the county, or at least that we are aware of, and then be able to move to the next tranche. And here's a breakdown in terms of the number of doses that have been administered. We've made significant strides in terms of our percentage of folks who are vaccinated within the county. We are just shy of Maryland average, a statewide average, but we have actually distributed the most doses of any other jurisdiction and local health department. Again, this just shows where we stand in terms of the number that we have received versus administered. We did have a delay last week in the doses due to weather that's been highly publicized. We did, receive those doses on yesterday afternoon for this past week, and we also received our 4,500 first doses for the next week as well. Again, just another breakdown in terms of the number of doses we received, percentage administered, and comparing to other jurisdictions throughout the state. And a breakdown of our hospital administered vaccines. We continue to partner and work with our hospital partners to get the doses out in a fair, equitable manner. And this is pre-registration statistics. Again, we can make this available. I believe this will be available to the general public on the public dashboard. And this is a breakdown of the types of, by occupation, the pre-registration statistics. And looking at the breakdown by age, as well as by race and ethnicity. We do see our 18 to 64-year-old group having higher rates of pre-registration in comparison to others. And heat map also of where the majority of the pre-registrations are. Again, and this is a map of looking at where we see overrepresentation for pre-registration versus underrepresentation. And unfortunately, a lot of those neighborhoods that do have more concentrated spots of underrepresentation in pre-registration are some of the areas that have been hit hardest when we look at COVID cases by geography. And this, based upon the equity framework that we've talked about at length, here is how this breaks down these the zip codes that have been prioritized based upon looking at those equity factors that we've discussed over the past several weeks in terms of how we're allocating those doses. And this is another breakdown by age as well as by race and ethnicity. And then when we look at strictly the doses that have been administered, how this breaks down in terms of the percent vaccinated of the total pool and the percent of the county population. So you do see, particularly in the Black and Latino communities, making up 19 and 20% of the population, but lower levels of vaccine uptake. And let me caution that I don't want to say uptake meaning that folks aren't getting it, but lower levels of being vaccinated right now. And some of those, part of that challenge is also disparities in the pre-registration information that we've had to be able to send links to, which is one of the things that we were excited about this weekend's event, utilizing multiple strategies to get folks in who may not have pre-registered per se, but we know that they're 75 and up and eligible for the vaccine. And I'll just go through these. Again, just to remind folks, the county apparatus 1A and 1B being ages 75 and up. But any of the other venues throughout the county are 1A, 1B, and 1C. We do know, again, remind folks that in addition to the county clinics, hospitals and health systems are providing vaccines, and retail pharmacies, including Giant, Safeway, et cetera, are also providing vaccines. But we don't have as much information from them in terms of who their target points are or what the particular numbers are that have been achieved so far. That concludes the presentation. I will stop there and turn the floor over to Dr. Stoddard, but happy to answer any questions you all may have. Thank you.
Good morning. I have a few additional updates. I look at the testimony that the various vaccine companies are providing to the U.S. Congress today, and I want to highlight a few things that are, I frankly see as very good news. So currently, Pfizer is producing between 4 to 5 million doses per week and providing those to the federal government. They expect by mid-March that to increase to approximately 13 million doses a week. So obviously about almost a 2.5-fold increase from what they are currently producing by mid-March. That's only a couple weeks away. Moderna has so far delivered 45 million doses to the federal government. They're currently doing about 5 million a week. They expect to be about 10 million per week by the end of April, by the beginning of April, sorry. And then Johnson & Johnson is having their emergency use authorization hearing with the FDA on Friday. They expect to initially have approximately 6 million doses available, but then they also expect to have approximately 20 million doses per month in March and another about 26.7 million doses per month in April, May, and June, respectively. And so there is a fair bit more vaccine coming on board over the next coming weeks and certainly, let's say 6 weeks, 2 months or so. Obviously, that will substantially change the landscape of vaccination availability in Montgomery County and in the state of Maryland. The other good piece of news that we had is, and I think the Mike Ricci from the governor's office shared this morning, we have seen a precipitous drop in the reflected infections of healthcare workers over the last couple of weeks in our contact tracing numbers. This is an excellent reflection of the fact that that pool is vaccinated, and now you're seeing the impacts of that vaccination. Healthcare workers have been amongst the highest, in the total infected pool, given their close proximity to working with other COVID positive patients. So seeing that drop and having it correspond with the drop in numbers that we've seen as a county, as a state, as a country, is showing us that the vaccine is working, and the vaccine is working not just to reduce significant outcomes, but it's also working to reduce overall infections, which is great. A couple of the key points, I want to touch on things that we have done. We're going to do a monthly child care town hall. We did our first one of those in a series over the next 3 months on last Wednesday. A lot of questions about how child care providers are going to be able to access the vaccine, a lot of questions about testing and other things. We went through and gave all the answers that we could over that. We actually had a partner from Montgomery County Public Schools on that call to talk about their reopening and the connection with the child care and aftercare and all of those things that they're doing. We did an economic town hall on Friday with Mr. Fletcher from the county executive's office and Ms. Kinch from the county attorney's office, talking about human resource issues during the pandemic with the business community. We have a meeting scheduled with, or in the process of scheduling, with the leadership of Nonprofit Montgomery. I know this is a request from many of the council members to talk to our nonprofit communities about their respective placement within the vaccine dissemination program. We have met with many of the nonprofits who are partnered through the Food Security Task Force and otherwise, and they collected are in the process of collecting their lists. But we do want to make sure we get out to the broader nonprofit community to help identify, based on function, where they fall within the state and local vaccine dissemination program. As I mentioned, Food Security Task Force, we did collect their lists from the food access providers yesterday. team is going through them to make sure that everything is in order, and then providing those to public health, so that, as Dr. Gales alluded to, when we're ready to move to that next tier, that we have those lists ready to go and can begin to disseminate vaccine to those food access providers, amongst others. Now, on the MCPS and non-public school numbers, just to give you an update, approximately 5,300 appointments have been made or complete at this point. There was about 600 to 700 that we heard late last week were being scheduled. So that'll bring us up to about 6,000 of the 9,000 needed for the March 15th timeline. There are some number that were inclusive of that March 15th timeline that also needed by the March 1st timeline. We're working with MCPS this week to get those through with our partners. As Dr. Gale said, we're not really ready to say exactly where that's going to come down. It's going to be a mix of different partners. But then also the non-public schools have had about 2,000 appointments available to them as well, and that will continue to proceed with 500 to 600 or 700 a week, depending on how much vaccine Hopkins gets on the given week. I think they were down at 2,000 this week from the state allocation, and therefore it'll be about 500 for both MCPS and for the non-public schools this week. They too were impacted by the delivery, and so obviously there will be there is a little bit of a delay in that dissemination to both our non-public and our public school partners based on the delays in receipt of vaccine from the manufacturers last week. I think that's all I wanted to cover, and I think we can go ahead and take some questions.
Terrific. Thank you both so much. It's very helpful. I think we want to stick to the 5-minute rule. We started out a little bit behind. Can I call on Councilmember Rice first, please?
So thank you very much to both of you. I'm going to try and be quick. So I represent Clarksburg Jail. It's in my district. I've heard that the employees have been vaccinated. Do we have a status on the inmates, especially those that are of older age, and whether all of them have been vaccinated?
No, not at this time. We haven't, that has not been a part of the county apparatus vaccinating so far, and waiting more information from the state to see if there will be a state approach in terms of providing vaccines to those groups.
But I would just say we do agree that that population, given their closed population, should be in an earlier priority group than the state has currently reflected. The same is true of our homeless population, just so we're clear, given their special circumstances. So we agree with your push to do that. And yeah.
Excellent. All right, thank you. And then when it comes to our schools, there's just been so much, and I know that the Education and Culture Committee will be meeting with our school system on Thursday to discuss about the reopening plans for Montgomery County Public Schools. But let me just ask this. I know that the county has done yeoman's job in terms of trying to ramp up efforts to make sure that our teachers are able to get vaccinated, to ensure that we can try and safely open our schools. Where are we with the status of prioritization of our teachers and vaccinations?
Well, I think Dr. Stoddard actually, he mentioned the statistics where we have. So just as a review, in terms of the process, we had asked both public and non-public schools to prioritize their staff that would be moving back. And in terms of MCPS, based upon their phased approach that they were going back in, they estimated there were approximately 9,000 staff members who would be a part of that first group. Now, as of the beginning of the close of last week, there had been 5,300 who had received an appointment opportunity, who had been scheduled to get the vaccine. And then I think in follow-up conversation, it was mentioned that there's approximately 1,500 individuals who would be going back in the March 1st window would need coverage. And that's who Dr. Stoddard was mentioning. We're trying to get coverage for within this next week before March 1st. And then there's potentially an additional 1,500 who would need access to the vaccine, who would be going back in the March 15th window. So we're prioritizing getting access for that first 1,500. And then we will hopefully be able to utilize similar strategies to be able to provide coverage for those additional staff who need it. And let me also make sure that I emphasize this too. We're not just focusing on public schools, we're also looking at how to increase opportunities for educators and staff at non-public schools as well at the same time.
And when we say teachers, we actually mean all school staff, not just teachers,
Yes,
but all
educate
folks
everyone.
that are in the school buildings. And then my last question is surrounding our strategies in tiers. Many people in the community have been reaching out saying that they're hearing that the governor may soon be moving into another tier phase. I'm curious as to whether or not you've heard anything from MDH regarding them moving forward towards another tier phase and how that might impact Montgomery County and its tiers and its ability to be able to continue to focus on equity when it comes to distribution of the vaccine.
Well, I think the governor has a press conference today. I don't suspect that will be what he's talking about. From my understanding, the state will be launching a new registration system for vaccines. So I anticipate that will be the subject of today's press conference. I don't have any clear information that would confirm or suggest that we're moving in that direction. I think we, from a health officer perspective, and even from county government, you all and others providing feedback to the governor's office, there has been a concern that we move too quickly to expand the number of folks who had access to the vaccine with a short supply, and we weren't able to capture as many folks in those upper level priority groups to get them closed out before moving forward. Now, as it relates to Montgomery County, we will continue, particularly with the government apparatus piece of it, we will continue to prioritize the groups and continue to move forward, particularly given the shortage of vaccines with the allotments that we have right now. And we will continue to promote the equity framework that we have put forward with the priority groups where we are now, as well as moving forward. We really do see the health department as ultimately in the larger system as supply increases as a safety net, if you will, for individuals who don't have access to other potential venues to get the vaccine. So I can assure you and confirm that that will continue to be a part of the approach that we take in terms of how we allocate the doses that we receive.
Excellent. And then if I do have one more minute, Mr. President.
Go ahead. Yep.
Okay, excellent. Just very, very quickly on this note, when it comes to the expansion of the number of vaccinations, has there been any talk about the state restoring back to the original number of vaccines that you have, or going up to the maximum capacity that you could distribute, which is 15,000 doses per week? Has there been any conversation with MDH about restoring the vaccines or getting up to the maximum number?
We've continued to advocate and push for more doses to the health departments locally as well as across the state, particularly given the increase in doses that the state has received over the last several weeks. We continue to advocate for that, for a host of reasons that we discussed before, as well as other strategies that would be able to expand not only the number of doses that we receive, but also a proportional amount of doses coming to the county in other sites as well, particularly in the absence of a mass vac site here in the county.
Thank you, Mr. President, and thank you, Dr. Gales and Dr. Stoddard.
Thank you. Councilmember Friedson.
Thank you. Appreciate all of your answers to this, particularly related to educators, teachers, and everybody else who work in the building, who are all working hard to educate our kids. A couple questions. Number one, related to the fact that we had all the weather-related delays. I know that we got the shipment from last week and this week yesterday. I appreciate you confirming that for us, since it's obviously caused a lot of concern for a lot of residents throughout the country, throughout the state. Number one, do we feel confident that we'll be able to administer all of those first doses this week before we get the next shipment, or the following week? And are we having conversations with the other providers, including the hospitals in particular, who I know you've been working very closely with, to make sure that they can handle the, basically the doubling of the capacity that they're required to do now, based on all of these weather-related delays out of everybody's control?
Yes, I do. In fact, if you look at the doses, we pretty much exhausted the doses that we received, our previous stash of doses. And when you combine last week's with this week's, that's approximately 9,000. That would be close to the number of the highest amount of doses that we had received once before at 8,600. I'm confident in the infrastructure that we have that we'll be able to do that. It creates the opportunity where we may be able to add additional clinics, particularly like the one we did this weekend over, under short notice to be able to get more people through the queue. We also, again, are looking at strategies where we may be able to support community vendors or partners with some of these pilot opportunities to be able to utilize some of those doses to still focus and target those priority populations that we are using at the larger sites.
Great. And has there been any conversation with the hospitals or other providers to make sure that they can handle it as the health department, it sounds like, can?
Yes, so those conversations continue. And for example, those are some of the types of conversations that we've been having to be able to stand up some extra opportunities and access points, for educators and others to be able to meet those deadlines.
And I think just about all the hospitals have been receiving well below their capacity. So a doubling of it would still be within the bounds of what they would be able to, I think, for example, like Holy Crosses can do 1,500 a day. They've been getting like 500 to 1,000. And so if they got 2,000, that's a few days of clinics.
Right. And to your point, everybody was was lowering their numbers, doubling gets back up to the highest point from several weeks ago. So we're basically getting back to where we were. I appreciate that. That's good to know. Related to that, there have been a number of public communications from some of our state partners that specifically refer to residents age 75 and older getting an invitation from the county for a vaccination in the next 2 weeks. I saw that and was caught a little bit off guard because it wasn't necessarily consistent with what my understanding was based on what we had heard. I just wanted to check on that to see, is that accurate? Do we have an idea or an understanding of whether that information came from the health department or where it came from? I just think it's important that we get this information out and confirm so that residents have an understanding of where things are and what to expect given all of the competing information out there.
I confess, I'm not aware of the specific communication that you're referencing. If you could send it to me, I could look into it. But I will say this is, we're making every effort we can to try to reach as many folks 75 and up and get as many invitations to that group as possible so that everyone does have an opportunity to get access to a link. Hopefully they choose to uptake it, or, plus minus. So that, we would be able to move to the next stage in terms of the prioritization group. I'd be happy to follow up with you on that.
Yeah, we'll resend that. I think we went through the channel we were asked to go through and hadn't gotten an answer yet with Linda McMillan sending along. I know I'm not alone in this, and there's some questions because we're fielding the questions from residents asking how this process is going to work, and at least no colleague that I've spoken to was aware of it. I don't know, Dr. Stoddard, if you had any.
Yeah, so I think this relates back to something that came up in our delegation call with the county's delegation, state delegation. And we were asked sort of a question along the lines of where we were with the pre-registration list. And we have approximately about 25,000, 75 and older on the pre-registration list remaining. And given the number of invitations that you have to send out to fill up a clinic, you usually have to spend out 2 or 3 times the number, because number one, of that 25,000, many of them have been vaccinated through some other mechanism. There's, as you saw in the heat map that Dr. Gale showed, we have a lot of 75 and older pre-registered from Leisure World, for example, and there's a specific opportunity being offered through the state and MedStar at Leisure World who are going to account for many of those 25,000. And so it was the team's belief from the pre-registration meeting that we've been having this last couple weeks that there would be about 2 weeks we would be offering all of those 25,000 people that appointment over the next couple of weeks to fill the slots that we're going to have this week with the increased doses we have, plus what the state is now guaranteeing us for a 4-week period, approximately 4,500 doses, so we can schedule those out over the next 4 weeks. And so it won't be a matter of someone getting a vaccine necessarily next week, but we ought to send the 25,000 appointments for the next 4 weeks to fill out all of those and be able to move on.
I appreciate the clarification. I just think it's really important when these things come up that we get information on it and be able to respond, because there's nothing worse than having information from state partners and us not being able to confirm it and us potentially having different information. There's already enough uncertainty based on all these things outside of our control, based on what the state has done, all the different partners, the different registrations. And, as much as we can have the information to communicate, it would be really appreciated, and it's needed in real time. Thank you, Mr. President.
Thank you. Councilmember Jawando.
Thank you, Mr. President. And as always, Dr. Gales, Dr. Stoddard, and your teams, I see Dr. Bridges on as well. Thank you for all the work that you all are doing. It's critically important, and we could say thank you all day. It wouldn't be enough. I just want to say how heartened I was by the East County Recreation Center site, and to see the diversity. I was honored to be there with the council president and Mr. Ziegler get his shop. It's also so many other people that needed to get it, and you just did it. It was run very well. I want to shout out to the vaccine hunters who were there outside signing people up and getting people pre-registered. One of the best things I saw when I came in was folks from that community that did not have an appointment that just wandered up and said, we're in the category, but got their pre-registration done right there because we took the shots to them. So kudos, and I'm glad we're going to do more of that. I'm also, and I've got kids yelling in the background, so sorry about that. As we talk about schools, it's a good segue. I'm very happy to hear that we are in the process of vaccinating all the educators and folks in the school building. Councilmember Rice asked and Friedson asked questions I was going to ask, so I'm happy. We know that some people are saying we're not opening up quick enough. Others are saying we got to get everyone vaccinated. So I think we're doing the right thing as far as the approach of the first dose. And I just want to publicly say that. I think that is the right approach to take. And I appreciate that we're working with community partners to do that for public and non-public schools. My question. So 2 things. The state mass vaccination site. For people who ask, we have all said we are pushing the governor, and again, we'll request Governor Hogan and to the State Secretary of Health, please give the largest jurisdiction in the state a mass vaccination site. Dr. Stoddard, Dr. Gales, we have offered, I know the fairgrounds, have we offered other locations? Is there any update on those conversations?
Unfortunately not, Councilmember Jawando. We continue to promote that. We've not received any feedback that the state has decided to put one here.
Well, everything we've been told is the state is continuing with their strategy for the next 3 sites, which are going to be on the Eastern Shore, Western Maryland, and Southern Maryland. After they finish their first 6, they've said they may revisit the decision to put additional sites around the state, including in Montgomery County. But until they get those next 3 sites that they've got pre-planned opened up and operating, they do not intend to open up a site in Montgomery County.
Well, that's disappointing, and we'll continue to advocate. Doesn't make a lot of sense, obviously, with the largest jurisdiction in most cases, some of the highest cases and infection rates, and one of the most diverse populations, that you wouldn't do that. And then my last question, one of the things we noticing, we had the African American town hall last night, and we didn't get to all the questions, but I saw in the chat a couple of times, and I thought about this myself. If you look at life expectancy for Black residents in the state of Maryland, our life expectancy for men and women is 75. That's the life expectancy for Black residents. If you look at everyone else, Black, Latino, Asian, it's 80 or above in the state of Maryland. And if you look for Black men, it's closer to 71, 72 years for life expectancy. If we're having an equity framework, and then there were several residents that were like, I'm 72, I'm an African American, my wife, we need to get the vaccine. How are we approaching that? And is there a possibility to approach that in the way that we target these vaccinations, realizing that life expectancy, because racism is a public health crisis, because of the social determinants of health, there's a lower life expectancy for certain groups and certain individuals?
That's an excellent observation, one that unfortunately is a reality that continues to be perpetuated year after year. We did discuss that and look into that. We've not made any alterations or changes based upon, the recommendations for the prioritization that we have been from the ACIP and the CDC recommendations. But those points are duly noted. They have been discussed. and certainly will continue to be discussed as we move from, 75 to the next age group, particularly within the 65 to 74 year old.
All right. Well, I would just ask, I don't know how long we're going to be in there, but, one of the things I've talked to you and Dr. Kroll about is, one of the issues we're having is pre-registration, getting enough, for example, African-American residents pre-register. If you opened it up to 70 plus or 65, I think we could solve that and still be able to vaccinate most people. But I know we need more doses too, so that's an issue as well. All right. Thank you for all the work you're doing. And thank you, Mr. President.
Thank you. Councilmember Navarro.
Thank you, Mr. President, and thank you to everyone, Dr. Gills, Dr. Stoddard. You guys look great, although I know you're working overtime, and so does Dr. Bidger. So maybe it's all that vitamins that you may be taking or something like that, but I'm glad. So yes, I mean, just a couple of things. Again, wanting to understand where we are with the vaccination plans for the initiatives. Obviously, this very much in line with the slides that you shared regarding the disproportionality. I was not surprised to see that map, but I think it just tells a story, and we do have, I believe, and very fortunate to have at least these two initiatives that are focusing so specifically on the two communities that obviously jump out when you look at the disparity maps. So wondering, what is the status for the Latino COVID-19 initiative vaccination plan, and whether the African American Health Program also has one?
So I can't speak to the specifics of what the initiatives are doing, but I can say that we have been in constant communication and conversation with them about partnerships. So for example, the mobile pilot that I mentioned has been a part of the LHI initiative, working with one of the specific clinics there. We met last week to talk about how to stand that up and what that would look like. And I don't have my notes in front of me on that, but we are hoping to be able to support that, at least in a limited capacity, hopefully by the end of the week, to move that forward, to get some data points in terms of how that would move. And that has been in consultation with the LHI team. Similarly, we actually met with all three initiatives and program, and we have been working with our colleagues at CCACC and the Pan Asian Clinic, and also with AHI, to discuss setting up a clinical opportunity there. We had hoped to do it last week, but we've run into some issues. We got to get some providers trained. And so we're hopeful to be able to stand up that opportunity again as a pop-up, as a pilot opportunity, to see how that goes this weekend. And with African American Health Program, we met with them. And you could think of, in some ways, the event this past Sunday as a partnership opportunity to explore, to say, even in the absence of physically putting shots in arms separate from participating, we did work with them in terms of community outreach, recruiting folks to get registered to be at the venue, to be able to participate in that, because we saw that again as a pilot opportunity to say we could partner on events where we may take care of the physical administration of the vaccine, but certainly the leverage of those networks, the leverage of those relationships would be helpful in terms of reaching out to those folks who we know are eligible but aren't registered in the system.
Thank you. And I think that we are very fortunate to have these initiatives, already stood up to deal specifically with COVID-19. And so to the extent that we can use their template and their reach to add these layers, we are, I feel like we were on our way. I had sent over also to Dr. Kroll, someone who contacted me about a mobile opportunity, and it's an African-American owned service as well. And so I think that we can begin to put the pieces together so that we get more vaccines. There it is, it's ready to go. Also, wasn't sure if we had gotten any update on the PretMod translation issues. I've been asked that quite a bit. The media keeps asking me. I know there was some kind of beta testing that was going on, but just, not sure if that had been corrected, if we have gotten any information about that.
Well, I think I referenced the governor's press conference today. I think they're going to announce the new registration system. So we'll get more information in terms of, hopefully the new system that is launched will address many of the questions, such as that that you raised, the concerns that were there in terms of the new system. I will say the beta test that we referenced last week was more specifically related to the security link. So when you received a link, it would disable you from being able to share it with others. It would be a one-time kind of thing. I confess I don't personally have any more information related to the translation aspects of the system.
Okay.
I would only add that
yeah,
the single link is also impacting our ability to be equitable too. And I'll give you an example of this. So yesterday, the clinic that was in East County, for example, was a great clinic. I think Travis, I don't know if you said how many people were vaccinated, but it wasn't quite as many as we had hoped because people kept sharing the link on listservs across the state. And so not only were they, couldn't we be equitable in terms of distribution, but it was non-county residents, in some cases non-state residents, which we certainly can't vaccinate. And so it just, one of the big pieces of feedback we've heard is, hey, if we had more time to get people scheduled into these clinics, more lead time, it would help from an equity and access standpoint, getting people who we want to target. The problem is with this system that if you share a link a week in advance, even with the internal team, they start to use it, it inevitably gets shared more broadly, and then you're fighting upstream against people who are constantly filling the slots and preventing people from access issues or other things from getting signed up. And it's just that's a huge problem in terms of even being equitable, not just your overall number of people vaccinated.
Oh, absolutely. I mean, I think that we've seen in the data, the whole issue with pre-registration is pretty startling when you see the groups and the disparity that does exist. And, let's hope that the governor will announce something that will help that through. My last question has to do with the CCI Health and Wellness program that has now been, assigned for federal vaccines. Do we have any update on that in terms of how many vaccines and who is going to be accessing the vaccines to that center?
We don't. We have again reached out though, and I believe we have a conversation scheduled. I want to say Thursday or Friday to find out more details.
Okay, great. Thank you very much.
Thank you. Council Vice President Albornoz.
Thank you, Mr. President. First, start with a statement. It is absurd that the state of Maryland has not yet reached out to our public health team to put in place the plans to establish a mass vaccination site here in Montgomery County. It is even more absurd that the next 3 locations that they are considering are in areas that are, I'm sure the governor, when he does announce that moves to the next phase, will be moving to the next phase because of their small population and their ability to be able to vaccinate a larger percentage of their residents. It is absurd that from a public health standpoint, we, as the largest jurisdiction in the county, with the largest percentage of seniors, with the second largest percentage of minorities, have not even had a conversation about the development of a mass vaccination site here in Montgomery County. And so we are ready, Governor Hogan, to be able to stand up a mass vaccination site and have the capacity. It is in all of our best interest in order for us to be able to move that vaccination site here in Montgomery County. It will allow us to significantly catch up to where we are right now. And there continues to be this impression that Montgomery County does not have the same level of need of other jurisdictions across the state. And we are fortunate on a number of different levels. But for goodness sakes, we certainly have that need here. And so we need all of our residents, and we are all making plugs through our respective town halls. Last night's was incredible. You all did a fantastic job in educating our community about the importance of taking the vaccines based on science. And I so appreciate Council Members Jawando and Rice sharing their personal stories about their families, which I think is important and relevant to this discussion. So please, Governor Hogan, help us, help our residents who are your constituents as well. So sorry, just had to get that out.
Well said.
The second component, first is a kudos. I had the opportunity to visit our Holy Cross site recently and was very impressed with the partnership that the county has been able to stand up with Holy Cross. I know that all of our hospitals have a strong partnership and alliance with our public health team, and that through Nexus Montgomery, we've been able to meet regularly. And that has led to the ability to extend our reach, because through those partnerships, we're in a better position to outreach to residents and communities who may be homebound or have a unique set of challenges. what I have been hearing and learning about our private providers, Giant, Safeway, CVS, Walgreens, Rite Aid, there is clearly a willingness to partner with the county as well. But as Dr. Gales mentioned, we don't have the same level of partnership and connection that we do as we do with our hospitals, because that has been longstanding. And so I recently had a meeting with leadership from one of those companies who is being given direct access to vaccinations, and underscored their interest in partnering with the county. And so I'll be reaching out to our public health team. I know all of you are already having those conversations, but I think there's a unique opportunity for us, especially those constituent calls we're getting with tough situations that are unique and not through a partnership, we'd be in a better position to address. I think as we go to the next phase, that will be important to be able to expand our reach. And you answered two of my questions that we still had not received information regarding the beta testing for the new registration system that Councilmember Navarro asked about. I just want to once again underscore, this is a messenger situation. This is not directed at our public health team, but to our state officials. I know there will be an announcement later this afternoon regarding an updated system, but my understanding is that is specific to the mass vaccination sites, which is good news. That does demonstrate improvement. But as we've seen with our colleagues in the state of Virginia, there is absolutely the opportunity for Maryland to be able to move in the direction of a centralized registration system, which will lead to better efficiency, which will lead to better equality, and which will lead to giving us a better chance of catching up with the vaccinations that we feel we need to be, that need to be caught up. My final, I do have one last question. I've heard Dr. Gales and Dr. Stoddard, both of you mention in public forums over the last week, and just want to confirm, we're at close to 60% of our vaccinations for folks over the age of 75. Assuming all things remain equal and we get the level of dosages we have been receiving over the last few weeks, and there aren't any unforeseen challenges, I've heard both of you say it could be somewhere between 2 and 4 weeks that we move to 65 plus. Is that accurate? And I just wanted to confirm for the public.
I think so. I think we're optimistic that it will be on the sooner end rather than the later end, because again, our goal isn't to achieve 100% vaccinated. Obviously, ultimately, we want 100% of people vaccinated, but our goal would be 100% access to being able to schedule an appointment before we move to the next phase.
We've been doing roughly 12 to 14% as a whole system, not just the county portion of that population each week. And so using the similar type math, that's 25 to 30% over the next 2 weeks, and we'll be almost 90% vaccinated at that point. And so we expect the last 10% will be the hardest 10% to get all of those folks on board. So just to give you a sense of where I think we're at.
And final question, I may go back in the queue depending if how the next two colleagues go, but the what sort of notification will our residents receive who have pre-registered and 65 plus? I assume they'll get an email letting them know that we've entered into that phase and to be on the lookout for the possible scheduling of an appointment. But what is that going to look like for our residents who've pre-registered through our system?
So they'll get the alert and notification that we moved on to a next phase. Obviously, 65 to 74 is larger than 75 plus in terms of population. And so recognizing that we've been in 75 plus for a month, the first person vaccinated is 65 to 74, and the last person vaccinated in that pool will be separated by many weeks, given the doses that we have. And so they'll get a notification saying that we've moved into the next tier, but we'll just have to be very clear in our messaging that just because we're moving into the next tier does not mean instantly that everyone in that tier will have a dose of vaccine waiting for them. That's 90,000 plus people in our estimation. And so it'll be several weeks from the beginning to the end.
Got it. Okay, thank you. I defer back to you, Council President.
Thank you, Councilmember Glass.
Good morning, everybody. Nice to see you. Let me also start by acknowledging the governor's decision to create a centralized registration system for the state's 3 mass vaccination sites. It's a first step, but clearly he needs to do more. And as my colleagues have said this morning, not only do we need a mass vaccination site here in Montgomery County, the largest and most diverse jurisdiction in the state, but we also need the governor to expand the centralized registration to all vaccine providers, a true one-stop shop that residents are begging all of us for. And it's time that the governor acknowledged that the best practices from other states, quite frankly, states like West Virginia and New Mexico that have a centralized approach. And that centralized approach has resulted in those 2 states ranking 2nd and 3rd in their vaccination rates compared to Maryland ranking 34th. So Governor, please, we need you to continue being innovative and being equitable here in Montgomery County and for all Marylanders. And so switching gears, there was a report that I recently read from the CDC that was released earlier this month, and it found that members of the LGBTQ plus community have higher rates of underlying conditions. And I think some of those underlying conditions include asthma and cancer, heart disease, obesity, and kidney disease. And those rates are more prevalent in members of the LGBTQ plus community than in heterosexual individuals. And within the community, Black and Latinx individuals are particularly vulnerable. And according to the report, that data is based on population surveys over the last number of years. And the researchers also show that we don't know the true toll of the coronavirus on members of the LGBTQ plus community because that data hasn't necessarily been collected by the state, the county health departments, or any of the other providers. And so I'm curious if we are collecting any of that data, if the state is collecting it, and quite frankly, also if we know what the toll is locally on our LGBTQ plus community, especially Black and Brown members of that community.
Thank you, Councilmember Glass. That's an excellent point. It highlights one of the data challenges around pockets we know we are missing in COVID because so much of our surveillance data is self-reported and it is limited to age, gender, geography of residence, and in some instances, race and ethnicity. And to go back to last summer when we were trying to grapple with disparities by race and ethnicity, we saw that there was a large pool that was missing that type of information. So unfortunately, to your question, I don't believe it is captured anywhere in terms of the surveillance reports, in terms of how things are put forward and ultimately given to the health departments, and we aren't tracking that information locally. So right now, it would only be anecdotal information to be able to discuss the impact, but certainly something that I know I would be open to discussing how we could get more information, or at least be able to get more qualitative points of information so that we would then be able to use some of that information to take a closer look at the data to understand how we could pull some of that information out.
Is that something that would need to be done on the registration form, or where in the process would we be able to ask and capture that type of data?
Well, I think there's a number of places. So for example, if you're looking at who's getting tested, so, I don't believe there is a marker for that on, test registrations. I'm pretty sure it's not captured on the vaccine registration portals. I don't remember seeing that question on the PrepMod system. So actually in most venues, I don't believe there is an opportunity to put that information on, quite frankly, honestly.
Okay. Well, as we have been, working through and saying since last year about our data collection and about our minority communities, this is something that is, reaching national consciousness through the CDC report. So something for us to continue working through. Excellent. Thank you very much.
Thank you. Thank you, Councilmember Katz.
Thank you very much, Mr. President, and thank you to Dr. Gales and Dr. Stoddard. I did want to start off by saying that I was going to mention this as well, but I sincerely agree with Vice President Albernaz about the mass vaccination sites. And I think it should be noted that we all should be so appreciative of the Montgomery County Fairgrounds. It is not owned by Montgomery County. It's a nonprofit, a private a piece of property that is owned by a nonprofit that is willing to step up to help our entire community, and that the state is not willing to let them step up with us to be their partners on this endeavor. So I think we need to emphasize that again, and to thank the Montgomery County Fairgrounds for their offer of help. And also to the question about the email for the pre-registration for those of us who are over 65. When I pre-registered, I received an email immediately back saying, thank you, you're now pre-registered. And I would hope and assume that we will be as efficient when I can actually register for an appointment. So I thank you for that. And I do have just two very quick questions. I've been asked if someone who has received the vaccine, they've been inoculated, can that person still be a carrier of COVID and infect others?
Yes.
The answer is yes. Okay.
Yes, so there's actually a lot of studies ongoing right now to answer. Dr. Gale's answer is correct. The answer is yes. It is likely that the person is less likely to transmit if they've been vaccinated than if they have not been vaccinated. The question is how much less likely,
Right.
and that's the focus of some ongoing research right now. Some of the early studies suggest that it could be as high as 90% less likely to transmit, but that may vary based on a whole bunch of characteristics about the person, the demographics of the individual, the demographics of the recipient who they might be exposing, as well as the strain. There's likely a whole bunch of variability in that, but it is very likely that being vaccinated makes you less likely to transmit, but that less likely is almost surely not zero.
Okay, thank you. And then my only other question is, do we know how many people over 75 have received the vaccine from other entities other than Montgomery County in the percentages that you showed before?
We do, and I think we have internally a dashboard that shows us the provider. It's not finalized, so it's not public yet, but looking at that amongst our 75 plus population, I think the county has done like 46%, I believe, and the other partners have done roughly 54% of the 75 plus.
Now, is that included? Are they included? Are the other partners included in the percentages that you're showing on your graph?
Yes, that's all. Yes, the 42%, 42,000 people vaccinated is all partners. And so the county has done just about half that, I would say.
I got you. Okay. Thank you very much. Thank you, Mr. President.
Thank you. Councilmember Raymer.
Thank you so much. Question about the variants. Is there any new information about spread of the variants?
So we know that there are, thank you for the question. We continue to investigate a number of cases that have been suspicious, where there have been, the samples have been sent to the state to sequence. But beyond that, I don't have any other further information to share. We continue, had a conversation with some peer colleagues in other jurisdictions, actually in other states yesterday, and we all are just cautiously awaiting and hoping that they don't materialize and pan out, but we do recognize there's potential for that.
Okay, thank you. We're making a lot of progress with vaccinations for teachers and educators and employees in the school systems. I really appreciated the projection of our ability to really match dosing to the phased return. I think it would be very helpful if the county could put that down on paper or create an infographic or do something, because I think there's a lot of confusion. I guess I don't think the good news has made its way, out very far. And it might help calm the conversation to know that it is, we believe, that we're committed to doing that. And I think we should commit to doing that, first dose. As a side note, there's growing evidence of the efficacy of the first dose, which is very encouraging as well. But if we could just, have a written agreement with MCPS that we can match first dose to their phased return, I think that would help a lot. And again, it just appears to me from what you've explained that that's not really a stretch. I know it's probably makes you uneasy to commit to anything in this crazy environment that we're in. But I think part of what makes this whole conversation so challenging is just the uncertainty. And so I just wanted to encourage you to do that. Can you talk about childcare and just explain in a very broad way where we are now with opening, or what the status of it is, but what is a timeline for childcare providers in your opinion? I guess there's two things I'm generally in agreement about continuing to hold tight, but childcare and then putting out information about spring sports. I think we have to help the leagues understand where we're likely to be, and given factors, there's certain things that might come into play, but where we're likely to be in a month, when they are hoping to be fully operating. There's other sectors that just have that long-term planning, but in any event, if you could talk a bit about childcare, and then is there a plan, are you working on yet, or could we start to have a focus on spring sports and figuring out what we can do to clarify issues for the youth sports, especially?
Sure. Thank you for your question. So I'll actually answer the second one first. I think it could be addressed a little bit easier. Our team has continued to meet with, for example, the MCPS sports folks to do planning they've been meeting since last fall to discuss those practices. So a lot of those conversations are being had. We do know that there are, private sports groups that have questions. We're trying again to keep the guidance the same and universal. So what applies in one setting applies across the board. But we also have to caution folks to understand that, right now we're not going to, again, push and rush to do that. And likely when we do make recommendations for reopening, there will be some tweaks to it. For example, I believe that it's likely going to require face coverings across the board, which is different from, a lot of the conversation that was had last summer. Now, as it relates to the childcare piece, that again is another area that, as Earl referenced, there's been lots of conversations with the childcare community to discuss parameters and how to operate safely. It is one of the items that is in the queue that's being discussed. As we've talked about before, if we were to move forward and reopen different segments or aspects of things, which ones should take priority over others based upon, the type of work that's being done, the need in the community from a prioritization standpoint. And childcare is one of them. We had a long conversation back in the winter about waivers and things like that. So we are thinking through what that would look like, again, if the community transmission levels continue to improve. Now, secondary to that, we have been prioritizing or using an allotment, a part of the allotment of doses that we've received to provide vaccines to childcare providers, and we're trying to move them through the queue as quickly as we can. So, because we recognize they should be covered and need vaccination as well, as kids go back to school and kids and parents go back to work. So there's no definitive answers within that in terms of a timeline, other than to say that lots of the meetings to discuss those things have already begun and are in the process of coming up with some formal guidance that we can share with you all.
Okay, thanks.
Thank you. Council Vice President Albornoz.
Thanks. As we've learned over the last year, there's two triggers that make things complicated for us, because I completely agree with the methodical and cautious approach we've taken to reopening. But as the numbers improve, as the weather gets better, as the numbers are, sustained in a sustainable way improve, other jurisdictions like us are going to be looking at reopening. And oftentimes what happens is one jurisdiction will move further than us, quicker than us, or vice versa. My general question is, Dr. Gales, at one point there was a standing meeting that the public health leadership from the neighboring jurisdictions had. I think at one point it was almost on a weekly basis, discussing and comparing notes. Have those continued? And is there an opportunity for us to advocate to our colleagues from other jurisdictions to make sure that they're, in the same way we're asking for the state to coordinate with us, that District of Columbia, Northern Virginia, Prince George's County, Howard County also coordinate with us, because it impacts all of us when one of us makes a decision?
Yes, couldn't agree more. And actually, so for the first part of your question, the health officers, those standing meetings happen pre-COVID, during COVID, after COVID. In fact, we have a touch base meeting this afternoon to talk through those things. And so we meet on a state level. The Maryland health officers meet a minimum of 3 times a week to discuss things. The National Capital Region health officers, which again, for the folks at home, includes Prince George's, Frederick, Charles, DC, and the Northern Virginia counties, we meet at least twice a month to bring together what we're doing from a regional perspective. I know the emergency managers also have a similar platform where they meet regularly. And so we are all, again, encouraging that regional approach. And in fact, I spent yesterday and a little bit of this morning trying to coordinate some of those efforts because every jurisdiction is getting hit with the same questions. Everybody's numbers are improving, thankfully. But again, we want to try as best as we can to move together so that, we can keep transmission down across the borders as much as we can.
Would just add, the only challenge to that is that sometimes the decisions to move forward or not are not always public health driven. And so that's just a confounder in all of this, where the desire to be synchronous with everyone else can often sometimes compete with the political pressures in one jurisdiction versus another. And we have to balance out, do we move forward even though we don't believe it's necessarily in the best interest of the county, in the interest of being consistent with our regional partners? Those are always the toughest calls. I think we're certainly there's every reason to be optimistic about where we're moving based on the case totals, the vaccine dissemination increasing, the amounts that we're hearing coming from the federal government. Yes, there are these variants, and we do need to keep those on front burner, keep focusing on those. But again, as the vaccinations become readily available, as we move out of the winter months into more temperate seasonality, we're certainly moving in the right direction. I think you'll see that reflected in some of the recommendations that we'll be making over the coming weeks. Again, we were really just 2 weeks. We'll be 2 weeks this coming Sunday removed from the executives and the council's decision to open up indoor dining, and obviously we want to make sure that for 10 to 14 days after that period that we sustain our reductions, which we have thus far done. And then we'll be ready to have more conversations about what is the next step and in concert with our partners.
I appreciate that. Mr. Council President, I think maybe as a follow-up, in addition to the public health team, which I'm very happy to hear has continued to meet, we may want to send correspondence to our colleagues from other jurisdictions, council to council, to suggest that they're the same level of coordination. And I think the Council of Governments may be a great tool for us to be able to just have those discussions. I know we're having them informally, organically, but perhaps formally. And I know the county executive has continued to meet with the county executives from neighboring jurisdictions as well. I think there may be an opportunity for us too. So, and it's a good problem to have, as things are improving. And thanks to all of our residents who have been adhering to the guidelines, making very significant sacrifices. We're in the position that we're in, able to have the conversation that we're going to have on Thursday with the joint committee session between Education and Culture and HHS to talk about school reopening. So thank you all.
Thank you. Yes, let's team up on that letter. And I agree with the idea of using the Council of Governments more. Dr. Gales gave a great briefing last week. We have a powerful board member and council member Navarro. And I think I've spoken to their staff, but I think there's room for additional coordination with them. Thank you. Any other questions? Oh, Councilmember Friedson.
Yeah, I just had one quick follow-up. First of all, thank you to Council Vice President Alvarez. I totally agree with the leveraging, our regional partnerships. We've been talking about a regional approach to this for a while and need to formalize that, because we're not going to address this, and we've been talking about a lot without some level of conformity with regional counterparts. I did just have a quick question. We talked a lot about the mass vaccination site. I share the frustration and concerns that everybody else has with the largest jurisdiction in the state. We absolutely should have and need to have a mass vaccination site. I know the fairgrounds is an area that has been talked about quite a bit. I just was curious, have we sent a formal written proposal with clinical partners and operational dynamics and staffing, to the state? Has the county executive, followed up with that directly with the governor? Have there been any meetings? There was that productive meeting several weeks ago between the governor and the county executive that from all accounts was positive and constructive. Has that occurred? Have we sent some form of a formal written proposal, and have there been any follow-up, direct conversations between the county executive and the governor, either by phone or virtually or in person?
Aware of any additional one-on-one meetings the governor's had with the county executive? We've been largely working through principally Executive Director Shu, who has been sort of the lead. And I know, for example, that Mr. Madalino and the county executive have both been in, I will say, regular conversations about this particular issue, continue to request and providing additional information about the sites that we have identified as potential options in Montgomery County. And, just to be clear, we're not just simply sitting back and saying, can you do this, state? We are continuing to work with the locations to talk through and work out some of the logistic hurdles that may be in those states. And when we do those actions or we work through those hurdles, we do share that information with the state as a further push to encourage them to open a site in Montgomery County.
I appreciate that. I really do think that the direct engagement between the county executive and the governor is needed here. And I think a formal written proposal that he is specifically following up on would really help us to make the public case. So I appreciate any efforts that can move towards making that happen, and happy to support that in any way that I can. I know colleagues feel the same way. Thanks.
We do. Councilmember Jawanda.
Thank you. Just very brief. I'm loving the efficiency this morning too. Since we didn't bring it up, I didn't bring it up in my 5 minutes. It was brought up after, about tracing, being very careful and looking at the numbers 2 weeks from the Valentine's Day 7 a.m. opening, which would, we're not in that window yet. We will be next Tuesday. So if I could just, I hope that I'd love to be wrong in the sense that I hope it didn't increase anything. Can we just make that a part of the presentation? And this is just for Dr. Gales and Dr. Stoddard, just anticipating next week that we're going to have that question. If there can be some, maybe one level down, deeper analysis, or you could send it beforehand. I am just very interested. I'm sure we're interested. I'm sure the public will be interested just to know whether the overall case rate, but any contact tracing related to the cases that we have, just to have some analysis of that so that we can be sure we're heading in the right direction. Information I'm sure you'll be tracking, but just so we can have it, the benefit of it next week.
We'd be glad to.
Okay, awesome. Thank you. Thank you, Mr. President.
Thank you. I see no other requests to speak. So thank you all very much for joining us and for all your hard work when we don't see you. And we're looking forward to seeing you again later in this week. Thank you.
Okay. Thank you, and stay safe.
You too.